is attitude test?
Both, sir.
What is the need of this test, personality and attitude test? Why you are planning to administer this type of test?
So that we can, what we cannot communicate to them directly,
Mm-hmm.
uh, through this test, we can enlighten the children
Mm-hmm.
that these are the parameters you have
Mm-hmm.
to, and for our sake only, to cope up with this kind of situation only.
Mm-hmm.
Many has come up with so much standardized tools to check this and
Oh.
enhance ourselves.
Mm-hmm. No, no. See, personality tests are different. IQ tests are different. Attitude tests are different. These are various tests of identifying their behavior, whether they are able to understand whatever you are explaining. Okay. Here, in this case of you previous class, we have some doubts. That's what I want to clarify those doubts.
Yes, sir. You were almost about to
Can I
say
repeat your?
which principles we need to
Mm-hmm.
apply. One of my
Mm-hmm.
intelligent classmate has interrupted, and that has been broken.
Mm-hmm. You want me to explain those of approaching?
Yes, sir.
Okay. Means how to identify these children, problematic children. Is it that question?
Yes, sir.
Your question is that
Yes, sir.
how to identify the children, those are habituated to any drugs. Is it okay?
Yes, sir.
Okay. See, as I told you, there are some normal children who behave in the normal way. That is, for example, if it is a 14 years child, 14 years student, or 14 years individual studying in 9th class or 8th class, what is the normal behavior that we expect from this child? Performance in a normal way. Okay, that may be average performance, above average performance, or below average performance of scholastic activities I am talking about. Number one. Number two, behavior in a systematic or normal way with the other children in the class. Right? Whatever the
Yes, sir.
work be given to that child, she or he has to complete within the prescribed time. This is the normal behavior that we expect from that 14-year child in the classroom environment or the school environment.
Yes, sir.
If there is any deviations of his behavior, if he or she shows some sort of deviant behavior, means irregular in the classroom attendance, number one. Whatever the work given to that, whatever the homework or class are given to this child, he or she is not in a position to complete it. And what are the projects in the classroom, that is curricular activities, do the projects. That is, we are talking about his behavior related to the academic aspects. Secondly, the social development. This is the academic development. Second is the social development. Means he or she has to maintain the his normal relations or smooth relations with other children in the classroom. Number two. So I'm talking about the that is academic development, or you can say education development. This is the general expectation of educational development, educational activities from this child. Number two is social development, how he is maintaining the smooth relations with other children in the group or in the classroom. That is another aspect. Third aspect, how his emotions, any emotional disturbances, any emotional disturbances, emotional imbalance status of the child. So anger, some sort of fearness, anxiety. These are all some sort of issues related to his or her emotional status. If the class teacher or the principal or any other teacher, if he or she find any deviated modes, any elevated modes, or any type of depressed mode, any such type of emotions, if we find, that means his behavior is somehow odd behavior. It is not normal. More important aspects we are supposed to observe in different situations in the classroom environment. These are all the things, these are all the observations the teacher, the class teacher, or the principal or head of the institute, they are supposed to identify. If they observe any deviated, so you better check with the parents. You better check with the parents. Now, from the parent side, from the parents end, normal behavior. So the timings of his study, timings of his routines, timings of his wake up, timings of his sleep. These are all the common daily routine from that particular 14-year child. If the parents identified, if the parents observed any such type of behavior, then again, so they need to inform to the school authorities. See, one side I am talking about the how to observe, how to identify such behavior from the class teachers, from the school authorities, or the administrative, or it may be principal or head of the institution. That is one side. Second side is that second part is from the home environment. Home environment, the observation of this child in the home environment is the role of the parents. The parents' role is that the child's behavior in the home environment. If they find any odd behavior, they need to check it to the teachers. On the teachers' side, they are these activities. So what to do? You need to find out the reason. Otherwise, you need to find out the reasons of this particular deviant behavior. So even if the parent try to find out the reasons, if they are not in a position to identify the reasons, then they better to check with the peer age group change, peer group or classmates of the particular case or child. You can inquire with other classmates of this particular child to get clues, some information from the classmate. So, see, different source of getting information. Information from the parent side, information from the school teacher side. Third is information we are getting from the other sources like peer age child, or you can say classmates or the friends. From these because he or she, right from beginning of his day, generally these are the interactions of this particular child, interaction with the teachers, interaction with the friends, parents or siblings. One way or other way, definitely so you find they find if the parent, if the child, the student, the teachers are find any clue of his abuse of substance or taking any substance, then better to approach the counselor or psychological professionals. I think I clarify your doubts. Okay. Now we will move to the next topic, or next unit 21. Chronic illness. Okay. Some sort of health issues are very serious health issues, or you can say serious illness. The chronic illness means one or more impairment or structure of the person's physical aspects, the normal structure and of the particular person, the particular individual. The problem of their physiological, that may be a permanent issues based on that some chronic illness, or you can say disabilities. There are some grouping or there are some categories of this chronic illness or sudden. I am talking about the chronic illness and disability. In this chronic illness or disabilities, there are some 4 classifications. One is sudden onset of disability. Sudden onset of disability means if any injury or any accident, if any accident is took place, what happened? Maybe there is a chance of getting sudden issue of disabilities. Then disease-related health disorders. Disease-related health disorders. Disease-related health disorders means initially the health problem may be the minor issues, but slowly, if we neglect the health issues, what happens slowly after some time, after some days or after months, years, this leads to some sort of chronic illness. The chronic illness impairment. Chronic illness means some sort of injuries, some sort of sudden onset of disability because of the injury. First group, or you can say first classification. Second classification, disease-related health disorders. As I mentioned, in a initial stage of disease, if we neglect that issue, it leads to some sort of disorder or disability. That is the second classification of this chronic illness. Third one is that sensory impairments. Sensory impairment in any sensory organs is not functioning properly. That is the the neurological and neuromuscular disabilities. Four classifications of the chronic illness. Then how to dealing with the management crisis means when things are going well, economically, physical functioning may be quite good. So,
Sir, voice is breaking in between, sir. Sir, voice is breaking.
Is it okay now? There are four groups I'm talking about.
Yes, sir.
Then control symptoms with the medical management. Some symptoms may be controlled with the medical management. That is we are talking about the how to deal with the chronic illness. Number one. Medical management is the one aspect. And through this medical management, controlling the symptoms of his or her illness. It is carrying out the treatment regimens. So the same type of treatment, right? The same type of medical treatment we need to continue for so long time. Then in some cases, coping with an uncertain prognosis, coping strategies to be improved. Then adjusting to the social isolation. Here our concern as a psychologist or as a counselor, adjusting to the social isolation. Why so? Is disability. That disability may be any of these four classifications or four categories. As I mentioned, sudden onset disability, disease related to the health disorders, sensory impairments, and disability. Whatever the category may be, once they know when aware of their issues, chronic issues, the person may they get in isolation status. Means so distance
Hello, sir. Hello. Hello, sir.
Hello, yeah.
Sometimes it is disconnected and voice is not clear. It's breaking in between, sir. Maybe equipment or communication fault there.
Equipment is not, it's okay, but problem is with the net issues.
Oh, maybe, maybe, sir.
Yeah. But
Thank
anyway, I'm trying to communicate.
Overcome that.
There's no problem from my device. It is first only internet. Okay. So socialization and impaired social relationship with the peers. For example, if the chronic illness is the children and adolescents, what happens? Their social relations with the peers and siblings will be impaired. That means impaired social relations because of in the childhood stage, or it may be in the adolescent stage. Then the other important thing is emotional and physical adjustment of the family. If a family member is having this type of disability, disorder, or anything, neurological issues, so the physical adjustment of the family, other family members. One is emotional, so they need to adjust with the situation of the place. And just emotional adjustment, physical adjustment, financial adjustment, and social adjustment. These are the issues as a counselor we need to focus on. If it a chronic illness is with the adulthood means above age of 18 or 20 years. So what happens? Their job adjustment, occupation also impaired. So chronic illness in different ages. Chronic illness in the children, chronic illness in the adolescent stage, chronic illness in the age of middle age, chronic illness in young adulthood, chronic illness in the old age people. So these are the various stages, the chronic illness, the chance of chronic illness to the individuals. So based on the stage, based on the age of the person, okay, we need to counsel, we need to illness case. So another thing is that one caregiving, or can say caregivers. So one person is the victim, means the person who affected with this chronic illness. Number one. Number two is the other person who is giving the services to that particular person. That is caregiver service, or you can say caregivers. So both sides, from the person to the chronic issue, from a person of having chronic illness, counseling with this chronic illness persons of different ages, that is one aspect. Second aspect is counseling to the caregivers who provides the services, medical other services, the affected person. Both sides we have to give the counseling. So here in the chronic illness case, individual counseling. Individual counseling means the counseling goals always to be individualized goals of counseling. Depending on the person's age, depending on his level of understanding, depending on the symptoms of his disease or disorder. So depending on his financial aspects, depending on his status of family, depending on his or her family environment. So these are all the various issues we need to keep in mind while you are giving the individualized counseling. Individualized counseling means the counseling which provides based on the various conditions of the individual, that is individual counseling. Number two is group psychotherapy. Group psychotherapy. So group psychotherapy gives where people can talk about what they are experiencing as a person living with the chronic illness with other people. Here in the group psychotherapy, there are some groups of these similar cases. Like for example, if it is a cancer, the persons those who are suffering with the cancer, we will form a group of these particular cases. Okay, so here maybe some sort of group therapy different from support groups, which are usually run by non-professional. Generally, these from the individual side, from the group side, they themselves form a group or some sort of organization. They will form a group. Okay. So in this group therapy, some psychological therapies like psychotherapy groups typically meet. There is and they will discuss about their symptoms, what are their symptoms, what are their feelings, what are the emotions they will share. Okay, so this is some sort of 1 to 1.5 hour sessions will be given. And the formation of groups may be different. The formation of group from the individual side, they themselves form a group to meet once in a week or once in a 10 days time, to exchange their views, to share their emotions. That is one aspect. In other side, some organizations like support groups, or you can say some sort of rehabilitation centers, some sort of old age these organizations, they will form the groups to discuss the issues within the group. So this is one type of therapy, that is psychotherapy, or you can say group therapy. One is individual counseling, second is the group therapy. Third is the medication. Some medicine are some sort of that is those are medicines or medications can help me to this. Our third one is that like medication and one type of that is relaxation techniques. Okay. So these are all the other areas, other modes of giving counseling to the chronic persons with chronic. Then second side, I mentioned caregiving or caregivers counseling. Also are impact of the chronic illness. They'll definitely, the family members, one way or the way, the impact of the chronic illness of one, the impact of that person's chronic illness on the other members. Okay, it is quite common. So in that cases, in that condition, we have to give counseling to the caregivers also. That is caregiving counseling. Caregiver can be both physically and emotionally, they'll disturb the caregivers. Okay, so that burnout of the caregivers also will. Then maybe some maybe financial, maybe issue to the society, issues related to their so these type of issues we need to resolve related to the caregivers. Then another important area we as a counselors to focus on is self-care for the caregivers. They are busy, the caregivers may be busy in providing the services to the affected people. In that situation, they may neglect their own health. That means they may not be in a position to spend time to focus on their own self. That means self-care. then maybe there is a chance of neglecting their self-care. So here, self-care for the caregivers also one of the issues that we need to focus on while we provide the counseling to the caregivers as well as the persons of chronic illness. Then some type of social support also, area of social support also. As a counselors, we have to give the counseling. So some type of social support system like emotional support, some sort of cognitive and some sort of support by providing materials or some sort of foods or some sort of devices to the chronic ill affected persons.
Excuse me, sir. Brief treatment for needle phobia. Please explain, sir.
You are talking about the
Needle phobia, sir.
okay. See, what is any phobia? What is phobia?
Yes, it is a kind of fear to a particular situation or something. Sir.
Mhm. Mhm. Any example?
Hydrophobia.
Mhm.
Mm. Phobia towards some animals or like that. So
Mhm. Mhm. Okay, so hydrophobia, agoraphobia, these are the various phobic conditions. In any phobia, the main issue of that means main psychological issue of this phobia is anxiety. You know, by
yes.
seeing that particular animal, by seeing that height places, by seeing that some sort of blood, by seeing that water, their anxiety will be increased.
Increased.
Okay, yeah. So we know any sort of anxiety, maybe general anxiety or specific anxiety, like you are mentioning some sort of phobic condition. So one technique is that is, the technique already I explained that
Desensitization, sir.
systematic desensitization.
Okay.
So I already again I try to repeat. There are three terms or three parts of this technique. Systematic desensitization means sensitization. Desensitization is the first part. Second is the desensitization. Third is the so sensitization means whatever their feelings, whatever their emotion like anxiety, we need to
Exposure.
desensitize it. Desensitize it. We need to desensitize it. So whatever the phobic condition, whatever the anxiety, that anxiety to be desensitized. Got it? And
Yes.
systematically desensitized means stepwise desensitized. Sensitization, desensitization, then stepwise desensitization or systematic desensitization. Now coming to your point, that means treatment for needle phobia. What is the phobia here? The phobia related to the needles or
Medications,
injections. Okay. So here in any type of phobic conditions or phobias, hydrophobia, agoraphobia, even needle phobia also. Okay. As I mentioned, desensitization, then systemization. Okay. Here, first of all, we have to show the needles or picture of needles, images of needles. Got it? When they see the needles or when they see the images, photos of the needles, what happens? Pictures of the needles, what happens? Tell me, please.
Mm.
Their anxiety will be
Increased.
Increased. So the moment they see the injection to the patient from the doctor is giving some injection to the patients. If they see these pictures, if they observe this type of images, their anxiety will be increased. For example, the moment they see these pictures, the anxiety is increased up to the 10 points. Just one example I am talking about. 10 points. When it is the maximum level. So if the time is passing from 1 minute to hello.
Hello, sir. Voice is
Yeah.
breaking.
My voice is breaking.
Yes, sir.
Oh. So here, the moment they see the picture, as I mentioned that anxiety will be boosting up. So, for example, in that particular moment when they see the picture of these needles, if 10 points anxiety, if they are there in the situation, if they are there in watching that particular picture, slowly the anxiety points may be decreased 10 to 8, 8 to 7, 6 like that. When it is passing, the allotted time is increasing, slowly the level of anxiety is decreased. Got it?
Yes, sir.
You can show it in the graphical representation also. On the y-axis, you can take anxiety. The y-axis time. When the time is increasing, slowly the anxiety level of anxiety is decreases. So the same case, even the needle phobic condition also. When you already mentioned ERP, exposure response prevention. Generally, for phobic cases, we will the main technique of addressing these issues only systematic desensitization. If it is the chronic cases of this phobic, or in some case, what happens? These type of phobic cases initially, slowly, after some years, if these are not addressed, not is it can in the case actually of ERP. But phobic cases, specific phobic cases, better to use the technique of systematic decision. Any doubt?
It is clear, sir. Thank you, sir.
Yes. Yeah. So these are all some counseling techniques of chronic illness. So yeah, here anxiety means some symptoms of anxiety. One thing I want to explain to all students: whenever you answer these type of questions, for example, how to give the counseling to the chronic cases, how to give the counseling to the drug, that is substance abuse cases, how to give the counseling to the behavioral cases. Okay, if you see this is from block 3, all 11th, 12th, 13th, 14th, 15th, 16th, 17th, 18th, 19th, even 20, 21, 22, all these up to 23, nearly some 10 units are given in your course of counseling psychology. For counseling techniques, counseling for in this 11th unit, counseling for groups, counseling for individuals. From 13th onwards, counseling for marital issues, counseling for sexual issues, counseling for family issues, counseling for women and elderly, counseling for children with behavior, counseling for vocations, career counseling. Then counseling from 20th onwards, counseling for substance abuse, counseling for patients of chronic anxiety, depression, counseling for stress. Nearly 8 or 9 units are given in this course of counseling psychology to give counseling for different cases. For example, counseling for children with behavioral problems. So how to answer these questions means, first of all, what to do? You have to define what are the behavioral problems. Got it? Then what are the symptoms of behavioral issues? For example, in the behavioral problem, if you see the ASD cases, in behavioral problems, some sort of cases related to the ADHD. So, if the question is like that, what is the counseling procedure for the ADHD cases? Counseling for ASD, autistic spectrum disorder. Counseling for behavioral issues. So here we can't give the direct counseling to these children. You can't write this directly. So better to define the issue first. For example, if it is the case of ASD, what are the symptoms of ASD, autistic spectrum disorder? Defining of ASD. Definition of ASD. Definition means only symptoms. If you mention that itself is the definition. What is the form of it? Attention deficiency in hyperactive disorder. What are the symptoms of ADHD? Then if it's the case of chronic illness, what is the chronic illness? What is meant by chronic illness? What are the symptoms of various chronic illnesses? Okay. Then after that, you have to write the reasons of factors of the issue. For example, substance abuse. Substance abuse, how to give the counseling to the substance abuse chain. What is substance abuse? As I mentioned yesterday, these are the substances. These are the different type of classifications of substance use. Then what are the symptoms of substance abuse chain? Because are having this type of habit. Those symptoms you have to explain. Then what are the reasons of this issue? Whether it's family reasons, family environment is the reason, or parental issues may be the reason, or the school-related issues may be the reason. Reasons are the causes you can write. The same way, now the other topic is 22nd unit, counseling for the anxiety and the depression. Counseling for anxiety and depression. Okay. So even the counseling for the anxiety and depression also, what to do first? You have to explain what is anxiety. Okay, you need to define that it is symptoms of anxiety. What are the symptoms of anxiety? How can you say if the person is having anxiety symptoms? There are some features of anxiety. Means some of psychological symptoms, somatic symptoms. Okay, based on these symptoms only, you can say he is feeling with
Anxiety.
Apprehensiveness, fearing, feel some feeling. Okay.
Sir, if you can share the
Irritability.
PPTs or the slides also for the same today's session.
Slides, generally I won't give any slides. It's okay. Clearly specify.
Because
slowly.
today the voice is not clear. It's breaking.
Okay. Within 15 or 20 minutes, you will sum up the class now, because the problem is from our side also. There may be some internet issues. So here, the main symptoms of anxiety is psychological symptoms like apprehensiveness, then feeling tension, worrying excessively without any reason, then routine with the family members, not with the friends, losing temper easily, feeling restlessness, okay, and unable to concentrating, not a person to focus on any activity, forgetfulness. These are all some symptoms of anxiety. I repeat, we are discussing the counseling to the anxiety. Okay. So the symptoms of anxiety is that there are some two important categories of symptoms. One is psychological, second is the system. In psychological symptoms, apprehensiveness, tension, irritability, worrying excessively, unable to concentrate, forgetfulness, lose control on their mental functionings. These symptoms are related to the psychological domain or psychological aspect. Second is physical features or somatic features. Here, palpitations, number one. Then chest pain, muscular tension. Okay. And pains, muscular pains, shortness of breathing. These are some symptoms of physical aspect. So psychological symptoms and the somatic symptoms. So define the person of the anxiety of a person based on these symptoms. Okay. Then what are the reasons of anxiety? So the reasons of anxiety may be, one important thing is genetical. Any type of issue to know if you want to study the reasons of that particular issue. First category is the genetical reasons. Maybe if it is ADHD, ASD, behavior, chronic illness, or maybe substance abuse. So the major two categories of reasons. One reason is genetical reasons. Second is the environmental reasons. So the same while here also, the reasons may be genetical or the reasons may be some sort of environment. Environment means family environment, workplace environment, school environment, any organizational environment.
Sir, you mean that it is
Okay.
hereditary basis, sir? Hereditary?
No. In general, I am talking.
Okay.
First. So here, there are two broad categories I am talking about.
Okay.
One category may be genetical, the other category is the environmental. So it can't say only the genetical reasons of any maybe issues. There could be the chance of genetical reasons. Yeah.
Okay, sir.
Then environment. Environment, again, there are different type of environment. What are the other environmental? Then workplace environment,
Social environment.
organizational environment. That organization may be school or any organization environment. Okay. Other reasons, we can easily mention these reasons, madam. See, prenatal, natal, and postnatal reasons. Yeah. For example, if there is any case of ASD or this SLD, specific learning disability, even ADHD case also, especially for some development delay, the cases of development delays, maybe cerebral palsy, Down syndrome, neuromuscular cases, Yeah. What is the main reasons of these cases? Yeah, CP, DS, SLD, ESD, IDH. Now, all these 5 or 6 development delay, these are all known as a development delay, developmental issues. Developmental issues. How can you say developmental issues? There are some developmental milestones the individual is supposed to achieve in the particular age group or stage wise. If the developmental milestones are delayed, it leads to some sort of developmental disabilities, DDs, or intellectual disabilities. Yes. So in these developmental issues, any other issues, as far as we are concerning about the two important genetical reasons and environmental reasons. So even the environmental reasons, environmental causes, one environmental reason is that prenatal. What is the prenatal environment means?
From the time of the conception
Till
in mother's womb, sir.
till the delivery time date.
Till the delivery time.
Yeah, yes. So it is 200, total how many days it is?
280,
220 days.
270, 270.
Mm.
40
Tell me.
weeks time maximum, sir.
Mhm.
And the days we have no idea. 36 or 37, maybe by those weeks, baby is born. And if it is full term, it is 40 weeks.
Mhm.
And premature baby may be before 36 weeks.
Face if you want to write any completed examination of your UGC or NET or a state eligibility test in psychology, this is the important question, no? So the time of the
270,
days,
270 or 280 days, sir.
so 280 days is the prenatal stage age. The age of prenatal, the stage or the days of period of prenatal means if you appear for any NET examination or set examination in psychology or any UGC or further of completion of your master any other need to go through the entrance examination or the any other UGC or NET, no? So 280 days is the prenatal period, or 9 months 10 days. In some response answers and options, they'll give 9 months and 10 days. So 9 months 10 days or 208 days is the prenatal period. Yes.
Yes, sir.
Hello.
Yes, sir. Yes.
So my voice is audible now.
Yes, sir.
Yes, voice is clear and audible, sir.
Yes, sir.
Good, good. Yeah. So this is the prenatal stage. So the prenatal environment, prenatal stage. So some issues are depending on the prenatal period. Means if the mother is having some sort of stressful conditions, she is having some sort of chronic illness in this particular period. But the impact, that negative impact may be on the child's various developmental milestones. Got it? That is one important cause. As I mentioned, we are talking about reasons or causes of anxiety, causes of depression, causes of developmental disorders, causes of chronic illness. So here, this also we need to mention prenatal reasons. Okay, in examination point of view, in broadly, I am talking about the two categories like genetical reasons and the
Environmental reasons.
environmental reasons. If you want to write in a deeper, genetical reasons means any abnormalities in the chromosomal abnormalities, chromosomal deficiencies, chromosome, for example, DS. What is DS?
Down syndrome,
Down syndrome
sir.
cases.
Down syndrome.
Down syndrome case, Fragile X syndrome, Down. Okay, the chromosomal abnormalities also leads some sort of developmental delays in the later stages of the individual child. So this is also one important reasons of these cases, these issues. Okay, so one is genetical, another is the environment in the broad way. In genetical reasons also, any abnormal That is chromosomal depletion, and abnormality in the chromosome. Like Down syndrome, instead of 22, you know that one pair of chromosomal in the 21st chromosome, that is the trisomy. What is trisomy? Down syndrome is also known as a trisomy. Instead of two,
There is a replication of 21 syndrome. 21st syndrome is replicated, double maybe. It's like. Yes, sir?
that is instead of two, it is three chromosomes.
Yeah.
That is the trisomy. Okay, or that trisomy is invented by the Dons. The scientist name is Don. That is the reason Down syndrome. Okay. Then Fragile X is the name of the scientist who invented this syndrome. That is Fragile X syndrome. There are some sort of abnormalities in the chrome. These also reasons of the abnormalities, the reasons of the chronic or any other disease. Number 2 is natal reasons. I am discussing. I already explained about the prenatal 280 days issues. Second is the natal, or you can say perinatal. Perinatal means at the time of
Delivery.
Delivery, sir. Delivery.
Deliveries.
delivery. Yeah. Again, there are 4 or 5 issues we need to check in deeper way. One is
Normal
Whether it
delivery or force cesarean.
Then
Mm.
Vacuum babies also, vacuum.
okay, then they're better to use the terms. Yeah.
Okay, sir.
Okay, please write the term. Here, one is that normal delivery, or you can say full term normal delivery. FTND. FTND means full.
Means 280 days, sir. 280 days, sir.
Yes, normal delivery. Okay, number 1. Number 2 is C-section delivery, cesarean delivery, you can say. Number 3 is you are talking about forceps delivery. Okay. Number 4 is
Premature.
breech delivery.
Breach. Yes, sir.
Yes, got it. So type of delivery is one important factor of any issue. Number 1. Number 2 is birth color. Birth color means what is the actual normal birth color of any? It is infant. It is the light pinkish.
Light
Pinkish color. Light pinkish color. Okay. That is the NBC, normal birth color. NBC. Normal birth color is pinkish. So if there is any other, what are the other colors? Bluish color. Bluish color means that, yeah, it is affected by the jaundice. Okay, that is the reason they'll keep in the ICU, NICU or incubator. So first one is type of birth. Number 2 is the birth color. Number 3 is the birth weight. Birth weight. What is the normal birth weight?
2.5, sir.
Yeah, 2.5 to 2.2, 2.32. Okay, up to 4. This maximum is 4 or 4. That is not problem. But here, if it is C, LBW or NBW. NBW means normal birth weight. Normal birth weight is, yeah. LBW means
lower birth.
Low birth weight. If it is below the weight of 2 that is 2 kg, that is a low birth weight. Okay. So birth type, birth color, and birth weight. 3. So these are all related to the natal period, prenatal, postnatal. Sorry, prenatal and natal. Then postnatal means any jaundice affected or any seizures, any major health issues within the age of within the period of 2 weeks to 2 months time. It is also comes under the postnatal issues. So these are all the various reasons you have to check. I am talking about the first of all, defining the particular problem, maybe anxiety, it may be substance abuse, it may be development delay, it may be the anxiety, ADHD, whatever. So you need to define that. Second is the symptoms. Third is the presence of this particular issue. Then in some cases, phobia. Here there are different type of phobias are given here. Specific phobia, social phobia, obsessive compulsive disorder, OCD, then PTSD, post-traumatic stress disorder, then acute stress disorder, generalized anxiety, that is GAD, anxiety due to general medical conditions, substance-induced anxiety disorder not otherwise specified. So in this DS, there are some classification of anxiety based on the DSM. What is DSM-4? Anyway, these are the various types of anxiety.
Diagnostic
So
statistical
now how to,
manual for
yes, it is DSM-4. Now DSM-5 is also available. This previous it was DS. Then ICD-10, ICD-11. ICD-10 means International
Sir, I'm not aware, sir.
So DSM means Diagnostic Statistical Manual. There are some versions like 4th version, 5th version. Same way, ICD means International Classifications of Disorders. ICD, International Classification of Disorder.
Okay.
Now, that's it. These are the various classifications. So nothing to worry. You need not to explain all these things. So only I am explaining for your this knowledge and understanding. Okay.
Sir, sorry to interrupt you, sir. How can we differentiate whether the palpitations and chest pains are not or only due to
choking sensation.
anxiety?
Choking. Palpitation means choking. Choking sensation.
Okay.
That is the main
chest
difference
pain.
between these.
How can we differentiate
So it's only pain, no? Choking is different, pain is different.
no. Chest pain, real chest pain due to cardiac and anxiety chest pain.
Okay. So see, chest pain, cardiac pain, and you are asking the medical related questions. Anyway, I'll share my actual medical. It's a medical aspect. Okay. Anyway, so
yes.
yes. You see, it's only for time being. If it's a pain related to the gastric issues, only for it's a limited time. Whereas the pain related to the cardiac, so that will continuously, and starting from your neck pain, then shoulders, then your arms. As far as my knowledge is,
okay, sir. Because we have to differentiate both. No,
yeah,
that's why
this is the one difference between these four.
Okay, sir. Okay, thank you, sir.
Okay. So in the counseling also the same as I mentioned in the counseling of in this counseling, if it is whether you need to find out whether it is specific anxiety or it is a generalized anxiety. For example, OCD. OCD is it generalized anxiety or the specific anxiety? What is OCD, madam? Anyone of you?
Obsessive compulsive disorder, sir.
Obsessive compulsory disorder. OCD. So the obsessive thoughts leads to some type of compulsory activities. Got it? Here compulsory activities repeated hand washing, checking of lock. Okay.
Yes, sir.
So that root cause of these compulsory activities, or you can say repeated activities, is the obsessive thoughts. If you want to stop, if you want to reduce this, it reduces the obsessive thoughts. Why these repeated hand washing? Why the repeated hand washing? Why these compulsory activities of repeated hand washing means their obsessive thought. The obsessive thought is that I have some sort of dirty particles on the surface of my hands, on the surface of my body. Okay, that is the reason. That is the obsessive reason. Obsessive thought is the reason of their repeated hand washing of compulsory activities. After hand washing only, their anxiety will be
Decreased.
reduced, decreased. Okay, again the same thing. Even when their anxiety is increased, they'll go and they'll wash their hands. So that will be reduced or it will be decreased. So here the reason is that their obsessive thought. So dirt particles, because of the dirty, the thought process of their patients, that is their particles, to cleanse that, to clean that dirt particles repeatedly there. And here we had to provide counseling to that obsessive thoughts. These hands of compulsory activity. Further see this estimate design mostly cases them ERP means expose them to the same situation and ask the patient. We will generally whatever the we are in the is so we will ask patient of OCD to first. That is the first. That is hierarchy. Types of hierarchy we need to to see the picture, not the actual one, not the real one. Picture of dustbin. That is the thing or first session. For 2 days or 3 days, when the moment this picture, their anxiety will be high. So slowly, after 3 minutes or some 4 minutes are there, if they are focusing on the same image, photo, or picture of that is dustbin, after some time, their anxiety will be slowly reduced. The same things we will repeat, same practice. We will say same what we will ask them to do that. So after some days, so by seeing the picture, their anxiety will not be increased. That is the first part. The second part, second session means second part of that counseling. We ask the person to touch that picture of dustbin. We ask the patient to touch the dustbin picture. Immediately when they, the moment they touch that picture, the moment they keep their hand on that picture, on the photo of dustbin, again the same anxiety will be increased. After some, that is repeated activities, after some time, their anxiety will be reduced, even though if they touch the picture also. 2 stages, 2 levels. Then in third level, we ask the patient to go near to dustbin. They are very nearer to the dustbin. The same thing will be happen. What happens? Their anxiety is increases. But after some 2 or 3 times of the repeated activity of going to near to that particular dustbin, that means we are exposing the person to the situation. Whatever the anxiety, we will prevent that. Whatever the response of the patient by exposing to that picture or to this incident, Whatever response, we will prevent the response by doing the technique. Exposure response prevention technique. Is it okay? Is any doubt here in this?
No, sir.
So for OCD cases, here in this case of OCD, exposure response prevention is the technique. Yes, same way for other anxiety disorders also. This is various skills of counseling, various techniques of counseling for anxiety or to counsel the patient of anxiety. So first of all, we need to check the reasons of these issues, maybe any sort of issue, reasons we need to find out. Then even one other thing is that TPP, the time of that particular behavior, whose presence he is or she is showing that type of behavior, and the place. Okay, the place, the person, the time, whether it is morning or evening or afternoon or night time. The place, whether it is the school environment, whether it is in the family environment, whether in the organizational environment or in the social environment. The person. Some patients, they will show the deviant behavior in presence of the parents, in presence of wife, in presence of children. So the person, the place, the time, that also we need to analyze so that proper counseling, even for the PTSD case also, post-traumatic. What is post-traumatic disorder? Post-traumatic disorder also one type of disorder related to the anxiety.
If suppose if a person undergoes some kind of severe accidents or something.
Yeah, yes. That is the PTSD case. Okay. So rest of the part, that is depression and how to counseling for the depressed one, that we will discuss later.
Sir, one more doubt, sir. For panic attacks, how to deal with, sir? Some patients will get panic attacks.
So that's what. So panic attacks may be due to some reason.
Yes, sir.
Or the environmental changes.
Yes.
Madam, in about the panic cases, panic attacks, even any other case also, these are the minimum things we need to focus on.
Okay.
Settle in some other options. Direct solution of any psychological issues is not possible. Tentative solution is not worked out here in this case. Ready-made solution, tentative solution, temporary solution. No. If you are giving immediate solution,
generalized solution will not be also there, sir. It is different from one individual to another.
No, I'm not talking about the generalized.
Okay.
No, even from our end also, from our side also.
Okay.
If with the person of the individual, if there any professional is giving temporary solution, for example, someone they also generally what happens when we travel in the train or in any other areas, if we introduce as a psychologist to others, generally what is our experience? Maybe you also having some type of experience. Yes. So when they know about our profession like psychologist, immediately they will ask, sir, this is my problem. Is it any solution on your side?
Yes.
Is it possible, madam, to give the immediate solution to the psychologist?
No, sir.
Giving immediate solution means we are not at all a psychologist. We are not at all a psychological person. We are not at all a counselor. Immediately, we have to, if there is any question from the other end or any counselor, any other side, first of all, we have to go. The first is to be from the psychological. Okay, for example, any case person, there is maybe some issues of adolescent, like yesterday we discussed problem of adolescent, problem of substance issues of the adolescent, 14 years. What is our first response when you have an idea about his age of 14 years? Means he is or she is in the adolescent stage. Immediately your mind to recall what are the major characteristics of the adolescent stage. What are the physical characteristics? What are the psychological? You need to recall it. You need to remember it. Based on their characteristics, oh, you need to understand, oh, maybe these are the reasons. In this adolescent stage, maybe stress related to their physiological changes, sudden physiological changes. So that is the reason of his behavior. Nobody is there to share the some yes, some parents are busy with their activities. They are not bothered about the children's issues, especially in the girls' cases also. If they won't find the solution from the parents' side, in this case of 14 years, 15 years child, if they want to share those emotions with the parents or the siblings in the family, if that sharing is not possible with the family member, what is the next option? The same thing they wanted to tell to the teachers. If there is any teacher like that is favorite teacher, if the teacher is also not having time to focus on the issues of this adolescent girl or boy, what are the other options? Same, sharing these feelings or emotions, issues to the other children in this time. Slowly, what happens? They deviate from the actual path. Deviate from the actual. What is the actual system? Normal system. Discuss with the parents is the normal system. Discuss with the siblings is the sharing with the siblings is the and the normal way. Normal expectations from this particular chain. Or getting solutions from the teachers. If these both ends are closed, both ways are closed, the other way is that same sharing of these emotions with the peer group. So what I'm mean to say is, any case of any age, first of all, direct solution is not possible. So you have to get the knowledge of psychological theory or psychological principles, psychological laws, psychological experiments. Based on the psychological theoretical knowledge only, we will be able to solutions. Any doubts? Okay then. Thank you.
Thank you, sir.
Since audio is not used, we are unable to question.
Usha ma'am, like what page numbers we have covered today? 289 till what? Because the voice is very not clear and
Because voice is not clear, even my questions and what I wanted to ask also it wasn't.
yeah.
Actually, my question was very simple. The subject regarding substance abuse, the principles what we have as a counselors, what we have that one I couldn't. It's like I tried to make the answer, but I couldn't justify myself. That's the reason I raised the question in the class.
Mm-hmm.
That's fine. We have started from page number 892. Now, sir has covered 2 lessons. Anxiety also.
Yeah, anxiety he has covered, like dealing with chronic illness. So, like the material which is provided from the OU,
Sir
like
has given an overview gist of it.
yes.
Where how as a counselors we have to deal with the chronic illness and my question over here if sir is online if he's there means like if I am audible to sir how chronic illness means like how like sir has covered caregivers how what is the role play of them how they are dealing with the chronic illness and he has covered
So first we have to do the
children and adolescents, like
counseling for
children and adolescents, until depression, until anxiety. Means like page number 308, sir has covered.
yeah.
Depression and other parts. Maybe tomorrow we will be dealing with. If
Tomorrow I think we don't have class, right? The other session will be next week.
Saturday and Sunday. So tomorrow in the sense that only, like if we can come to know the depression across the lifespan, which is a very important and difficult question to answer. If we can, and,
No, in anxiety which sir covered, like prenatal, natal and all, where is that? Because
no,
I
that is
just
not there. Is like how we have to, like
yeah.
one of the ma'am has asked about the needle question. So from there, from chronic illness to we have jumped to this
Anxiety.
and phobia. Whereas in this we have only one phobia on the like now, as of now. Otherwise we have to cover as a counselor psychologist we have to cover and know all kind of phobia.
Actually,
Yeah,
it is there in the unit. That's why I put the question, ma'am.
No. I haven't. I don't have any kind of this thing. Needle phobia. It is there in 22nd unit.
Yes, 21 unit. I will tell the page number also.
Yeah, because we have jumped from page 290 to 308.
No. Brief treatment for needle phobia is in page number 299. 299.
Yeah, this is chronic counseling, a flexible approach.
Yeah.
It's like flexible approach in this where medication.
Yeah, sir has covered individual counseling, group counseling. Group counseling, he said it's physiotherapy here, psychotherapy, sorry. Group psychotherapy.